with us today. And as you may have seen and probably well know, the governor has declared January Healthcare Month. And no better time to do it than to start off this year, as so many healthcare issues are on the horizon of Minnesotans across our state. And the purpose of this conversation is to talk with healthcare providers, with those who are hiring in the healthcare field, about the employment situation in this sector and the opportunities that are available for Minnesotans to pursue careers in healthcare, given the great need that is in that sector right now, and just how important the field is to Minnesota's economy overall. As I said, I'm Steve Grove, Commissioner of DEED. I'm joined by my friend and colleague, Hamza Warfa, who's our Deputy Commissioner for Workforce Development. He and I will be leading this conversation. I have to leave at 11:30 for the announcements that we're making today with regards to reopening, but eager to start off this conversation with really a great list of roundtable participants. And given the number of folks who are on the call, rather than doing a round the horn of introductions, I'm just going to read off the list of folks who are here. And if I miss anybody, we'll leave an open floor for that. And then really eager to dive into the discussion on the topic. So we're first of all really grateful to have a lot of healthcare employers with us today. We have Deb Barnes, who's the Executive Director of Lakeview Methodist. In the room with her are Rachel Spencer in her HR department, and Sam Barber, who's a CNA. We have Stacy Long, the Director of the South Shore Care Center and Crossroads Care Center. We have Deb Hoganson, the Senior Human Resource Generalist at Grand Itasca Clinic and Hospital. We also have Nadine Reeland, the Director of HR and Education from Assumption Home, and Ashley Folwarski, the Director of Community Service at Assumption Home too. Jess Anderson from the Workforce Development Program at Mayo Clinic Health Systems is on, and Guy Finney, the Workforce Development Director at Mayo, is here with Chad Decker as well from Winona Health, who's the Director of HR there. We also have some education partners here who play a critical role in this industry. We have Dr. Marcia Danielson, the Vice President of Economic Development at South Central College. We have Nadine Holthaus from Rochester Public Schools, who runs the Adult Basic Education Program there, and Janine Mason, the Associate Dean of Nursing at the Minnesota State College in Southeast. We also have some partners and associations on here too. Kristen Saylor is with us, the Regional Healthcare Preparedness Coordinator from the Southeast Disaster Health Coalition. We have Nicole Matson, the Vice President of Strategic Initiatives at Care Providers of MN. Connie Hines, the State Program Administrative Supervisor for Career Force, our team here at DEED, has joined us. And Tammy Bieri, the Executive Director of Career Solutions at Stearns and Benton Counties, is here too. And then lastly, I mentioned Sam Barber before, the CNA from Lakeview Methodist. We also have Matthew Chisang, a recent LPP graduate from Minnesota State College Southeast program. And he'll be here as well from the employee perspective, which is critical to a thoughtful conversation. Before I move on, is there anybody who's joined us today for whom I didn't have the chance to introduce as we kick things off? Well, is that somebody chiming in or? Great. Well, we will dive in. Again, thanks for joining us. We've been looking forward to this conversation and this month for some time. It's a new year, it's a new moment in our fight against COVID in this state. The numbers have obviously improved significantly, in large part due to the great work our healthcare sector has done in this state. And it is a sector that is just so critical to Minnesota's economy. You all know this well because you're living it every day. This is almost 500,000 people in the state are employed in healthcare. That's the largest workforce sector in our state. Both the wages and the product that healthcare providers provide to Minnesota's economy are the largest of any industry in Minnesota. 25.7 billion wages in 2019 in healthcare. And it's just been a key role throughout the pandemic of our healthcare sector. It's one of the big reasons that the governor and our team are so grateful that we're managing COVID in a state like this. We have world-class healthcare facilities, a great healthcare system, and just amazing dedicated public servants working in this field. As we thought about how to begin the new year and what types of job types to really highlight, as we thought about some of the workforce challenges that Minnesota faces, one of the major areas that we wanted to begin with was healthcare. And not just because it's the biggest and maybe most pressingly needed in the state right now, but also we know that 4 of the top 10 occupations in demand right now in Minnesota are healthcare jobs, and they pay higher than the average wage of almost $54,000 a year is the average annual salary. and they bring about $37 billion to our economy every year. So we are blessed by a great healthcare sector in our state. 11,000 healthcare employers in Minnesota. That includes, of course, Mayo Clinic and the U of M. And it's just a strong and important sector for the future of our economy. This is also a unique time, as you all know, where given the way in which COVID-19 has progressed, there are a lot of individuals in Minnesota who have found themselves unemployed, who would never have imagined having been unemployed before. But because of the way in which the virus works, our hospitality sector in particular, and some of these sectors where there's just a lot of social gathering have had to take pauses. They've seen more demand. And so there are over 300,000 Minnesotans now every week who are applying and receiving weekly unemployment insurance benefits, for whom, you know, many aren't working at all, and a job in the healthcare sector is a very real possibility. And one of the things that we're trying to do as a department is for those who are willing and eager to help make that transition from maybe a job that might not have been in healthcare before to a job in healthcare. Again, given the good wage and given the good need, the strong need there, we believe, in talking to many of you, that a lot of those skills are transferable from other sectors to healthcare. In some cases, of course, degrees and things like that are needed, but in some other cases, I know many employers here and others do a lot of on-the-job training. So it is a field that we think has a lot of transitional possibility. And as we as a department really focused on reskilling as a key kind of theme of workforce development this year, again, because of the targeted nature of this pandemic and its effect on our economy, healthcare is really kind of the first industry that comes to mind, which again is why we've started off with healthcare as the first topic for this discussion. So eager to discuss with all of you and learn more from you. I'm going to first turn it over to my colleague, Hamza Warfa, our Deputy Commissioner for Workforce, to share a little bit more context on our efforts here, and then really eager to dive into the discussion. So Hamza, over to you.
Yeah, thanks. Thank you so much, Commissioner. Thanks for making time on a busy day, prepping for the announcement. Good morning, everyone, and Happy New Year. Excited to kick off 2021 with this healthcare roundtable for all of us, and very grateful for the partnership and the collaboration of our partners and everyone in our state. As the Commissioner mentioned, one of the reasons that Governor Walz proclaimed January as a healthcare month is to raise the awareness that many employment opportunities in healthcare are available now. There's a tendency for some to think that given the pandemic that we're dealing with, there isn't much of employment opportunities. But from day to day, week to week, we continue to meet with employers in the healthcare industry and other industries that have a lot of jobs that are available now. The Commissioner mentioned about the need for the demands in this sector, but also one of the key things about this sector is that a lot of the entry-level positions do not require a lot of certification, or you can get trained quickly and really get hired very quickly. Another opportunity, I think, in this sector that's relevant now is that, as a lot of people were displaced from their previous employments, the importance of reskilling and, transferring the skill set that you have from other industries, whether it's in restaurants or hospitality to healthcare, is really unique. And, we see that a lot of interest in demand. One of the things that we do in partnership with our, colleagues and partners in this meeting and also throughout the state is the work that we do at CareerForce. CareerForce MN is our portal or name for our workforce system in the state, as many of you know. And it's really important that, the work that CareerForce does is known and highlighted by employers and employees. Every month, we have pivoted providing more virtual services so that, we can meet the needs of job seekers and employers. So on a weekly basis, our CareerForce team does, employer virtual career fair on a weekly basis. Some are local, some are statewide. We do counseling, resume building, interview prep, and lots of different services. And we continue to engage communities in the way that we think would be most efficient. So for example, over the last year, we had the opportunity to connect, different communities using ethnic media, connecting with, local newspapers, connecting people, providing different language in the services that we provide. We've also engaged folks in social media, writing blogs. We also explore opportunities for co-enrollment opportunities as, more people are interested in, training programs that could accompany, different skill sets that can lead them to opportunities in healthcare. And as many of you know, last year we launched workforce digital services through our partnership with Coursera. It's a platform where over 4,000 courses can be accessed by job seekers. Many of the exciting courses include, people who might be interested in becoming a contact tracers by Job Hub University. It's really a course that I see a lot of Minnesotans taking advantage of. And so throughout, you will see, that in this type of pandemic crisis of proportion, the best way we will get out of it is through partnerships, collaboration. It's through working closely with our employers and job seekers. And so that kind of a collective impact can be realized as we work closely together. So I would encourage you to share and learn more about CareerForce MN as kind of resources. I see a number of our CareerForce partners who are also a part of this meeting today. So with that, we're here more to listen and learn from you. And so I'll turn over, Commissioner, and as you leave, I'll continue facilitating the conversations once the Commissioner leaves. Thanks, Commissioner.
Well, thanks, Hamza. Well said. We're here remaining to listen. That's just sort of the context, but really eager to hear from our participants here. And I guess what we'd love to start hearing from is maybe from some of the employers. What are some things that maybe someone who might be interested in the healthcare field might not know about finding a job in that field that you would want a job seeker to know? What are some things that maybe are myths or misconceptions, or maybe just kind of general highlights of jobs in the field that you'd want to make sure a job seeker would be aware of? And we'll just open the floor to any of the employers who would like to start with sharing.
Commissioner Grove, thank you very much. This is Guy Finney with Mayo Clinic. I mean, one of the things that I think is important for the general population to know is that our campuses are a safe place to work. I think I've been reading articles, reading several articles, because coming back to a comment that you made in terms of we do have folks who are sitting on the sidelines right now, unemployed, but yet here in Southeast Minnesota, we see, we have hundreds of job postings at entry level, whether it's nursing assistant, PCA, LPN, short-term training kinds of opportunities. And as we have conversations with our local workforce center, it just doesn't sound like we're getting a lot of numbers looking to make a change. And I've been reading articles to try to figure out why, and I think there's a number of reasons why. And some of it has to do with people are sitting on the sidelines because of childcare challenges and things like that. But one of the things I've been reading about is this fear of working in healthcare right now until the vaccine program is completed. But the reality is, I can speak on behalf of Mayo. I'm assuming my colleagues here are in similar situations. The atmosphere, our facilities are a safe place to work, and it'd be nice if somehow we could deal with that fear.
No, it's a great point, Guy, and we share this with job seekers all the time, that oftentimes workplaces are safer than any other environment you could consider because of those mitigation protocols. And particularly in healthcare, where you are global experts on safety protocols. So I'm glad you raised that point. Other thoughts?
And just the last thing that I'm going to say about this is, if there is a way that we can partner with EAD on actually trying to incent folks to go into this, and there might be programs out there that I am not aware of and I need to get myself educated, but programs where we can underwrite the cost of that college, or we can join DEED in a public-private partnership where we bring some money to the table, you bring some money to the table, and we truly just incent people to go into these quick training programs that we have available right here in our backyard. And like I said, I mean, we have like 200 LPN openings in Rochester alone. Doesn't include our health system sites across southern Minnesota. 200 PCA openings. And these are all fairly quick training kinds of experiences where we can move talent fairly quickly and help them as a person, but also help our economy move forward and solve our burnout and our mental health issues that we're seeing on the inside of our workforce. So those are my quick comments, and I look forward to hearing from my colleagues.
This is Nadine Reeland from Assumption Home in Cold Spring. I'm new to the healthcare industry from a human resource perspective in the last year. Although 30 years ago, I put myself through college working in healthcare as a CNA. Guy, I appreciate all your points. I've been brainstorming too. We're about 20 miles out of St. Cloud, Minnesota. So call it the suburb of St. Cloud. And we're seeing the same challenges from a perspective. There's all the contributing factors. Guy mentioned why people are afraid, or even college students' parents are afraid to let their child work in healthcare. And we have a nursing home, and then we have 4 different assisted living facilities on campus. One of the things I was brainstorming, Guy, which I did at a former position, it's directly through DEED, but it's the Minnesota Job Skills Partnership grants. And you partner with a college and you are able to offset those expenses. Now it has to be a training program, but it would offset our costs from a training perspective, which on the nursing home side I can do through our reimbursement rates, but on the assisted living side I can't, which is obviously much larger than my nursing home side. So, but the challenge is the colleges, and I know we have some on here, it's hard too for them from a resource standpoint, because doing the grants takes a lot of time on both sides to prep the grant, to write the grant, to field the grant. But it was an awesome grant that I received the last time in order to get those entry level positions in, get them trained up to speed. You have the colleges advocating for you. And I think lastly, the last point that we're seeing is the applicants we are doing. 80% of them don't even show up for the interview after you phone screen them. And I get there's people who truly are unemployed because there's a lot of people laid off too, like you say, on the sidelines because of what our needs currently are. But the extra incentives on unemployment is also unmotivating for a lot of people, especially like in the dietary and culinary field. So that's my wrap it. I don't know if there's, again, guys, some kind of, can we partner with the colleges? Can DEED come up with something simpler than all the time it takes for a grant? Because it is the PCAs, the CNAs, the LPNs, and I know there was a driving force for RNs a few years ago, and so we have all these people wanting to be an RN, but in elder care we don't have the need like in the hospitals for the RNs. We need the LPNs and the CNAs.
Great, Commissioner, if I may jump in quickly, if just to, thank you. So MJSP is one option, one opportunity that exists. We also, in the fall, led by Commissioner Grove, we launched the Good Jobs campaign, which really, was meant to help connect employers and job seekers. I know that, as an agency, we're focusing on family sustaining wages, and and I know some of those jobs are for some might not be the ideal jobs they're looking for, but it's a transition for many that want to go into it so that they can move into RN and other opportunities. I do also want to mention another opportunity, which is, we launched a MJSP initiative, funded initiative, which focuses on, finding opportunity for young people aged between 18 to 25 who are looking for employment. And what we are doing is, providing the case management, the necessary training, any barrier removal needed, for young people. That initiative is going to launch soon, and it's our goal to connect with employers and help be the supply and demand match between those two. So I would love to reconnect with some of you, especially Guy. I'll reach out and see ways we can help connect. Commissioner, maybe you want to add something to that? Well.
Yeah, no, I just appreciate the comment, and Nadine, the feedback on sort of the onerousness of grant applications, especially in an urgent situation where it's like, I don't want to fill a grant application. I want to get employees and I want them now. That's good feedback for us, and we will take that back.
Thank you, Commissioner. I was just going to say that we've done Minnesota Job Skill Partnership grants. We've done them, and it's been a vital tool for us with our Bridges to Healthcare collaboration here in Rochester, Minnesota, and we're thankful for that. But you're exactly right, Commissioner. Something that's more of a fast track. Yeah, we something that you could launch within a month. Yeah,
and I think that's an attitude Hamza and I and other leaders at DEED are really trying to bring to the agency, which is how can we streamline some of these application processes. Obviously, there are things that statute requires us to do that we need to live by, but there's a lot of subjective decisions that we make as teams that we want to be careful about, especially because I think what we're hearing here is this is an urgent situation. This is not just, oh, we could use some more folks. This is an urgent situation. These are jobs that desperately need employees. We've got some misconceptions about the jobs, and for many of them, a pretty fast pathway in if you're aware of it and able to apply. So we're Hamza and his team have done a lot on sort of the pipeline front, but it's that conversion piece and then some of the kind of programmatic stuff on MJSP and others that we're going to continue to work on. So I appreciate both those comments. Other thoughts from anyone on the panel on this topic of maybe job seekers finding their way into these fields and some of the barriers or misconceptions that might be there?
So this is Deb Barnes from I'm sorry.
Go ahead, Deb.
Okay, thank you, Commissioner. Yeah, so maybe just a couple more thoughts. First of all, I'd really like to thank DEED and the South Central Workforce Council for working together for so many things helping employers. Right now, I think the infographics that the South Central Council is distributing are amazing. They have, it's one sheet and it tells people exactly what they need to know about specific careers. So thank you for the help on those infographics. The Know Before You Go program, I think, is amazing. It's helping young people really to streamline where they want to go and how they get there. And then also the bridge classes that we've done in partnership with the ABE groups, I think, are teaching soft skills and have really, really helped us as employers to not have to worry about those skills because there are these classes now set up. I would just like to say, I think sometimes the things that people miss are, the sheer variety of positions in healthcare. If you maybe shy away from nursing, you just don't think that's who you are. But there is such a variety. Everyone on this call probably is something other than a nurse, but we have culinary specialists, we have maintenance specialists, HR, activities, social workers. So just, looking at healthcare, if you don't think you're cut out to be in nursing, there's a whole variety of other positions that we are also always low on, also always advertising for. And then also the growth opportunities, because we have, through legislation, the ability to pay for the CNA class. We have the ability to pay for people to go on for their LPN or their RN totally on our dollar, which the state reimburses us through our rates. So that's a piece that I don't think is well advertised, and people need to know. Come, especially to long-term care, and your career can basically be funded. Thank you.
It's a phenomenal point, Deb. I mean, and those are skills and training that are transferable to a whole host of other jobs too. So it's really important that people understand that. Nicole, you were about to say something a moment ago. Why don't we go to you?
Yes. Thank you, Commissioner Grove and DC Warfa, for the conversation. I just wanted to highlight the fact that shortages in senior care is kind of a chronic issue. This is not necessarily new to us, although it's been exacerbated extremely with the pandemic. So there's even more urgency. But I think there is this marginalization of senior care within the healthcare community as somehow being lesser than, and people on this call have done a great job today of highlighting all the opportunities that we have to offer. And oftentimes we're the incubator of the healthcare workforce. But I think that we need to, and I've been very pleased with kind of the society's reassessment of essential care and direct care workers and the value that they add. But I don't think that we can underestimate that as a potential barrier when people are considering entering into senior care. I really think that there is a need to highlight the value that this work plays for the whole healthcare ecosystem. If senior care isn't here, we take care of the same patients that they take care of at the hospital. They're transferred to us either because they need a place to live or a place to rehab. And you get that same similar clinical level of experience that you might in an acute care setting. But it's where life happens, right? So you get to make a deeper connection with the people that you care for. So I really kind of wanted to put that into context, the fact that this has been a chronic issue for us. And I think that all of us have a stake in addressing how can we ensure that there's an adequate workforce for senior care so that the entire healthcare ecosystem works. Because if one part of it is broken, and we all learned that in the pandemic, it is an urgent crisis that calls everyone to action.
No, it's a great point, Nicole. I mean, we could have had the same conversation a year ago before the pandemic even hit, with some of these same conditions on hiring already being a challenge. So it's like stress on top of stress, obviously. And, I think there's this notion, we hope, of people stepping up to the call of service in these situations, but the state can and should do more to both highlight, but also find other ways to incentivize these jobs to be discovered. So I'm glad you raise it. I
know time is it's almost 11:30, so I'll be happy to continue facilitating, and feel free to leave anytime you.
Yeah, thanks, Hamza. Thanks, everyone.
Sure. Thank you so much, Commissioner. And so we'll continue the conversation. I'm curious to, for someone who might be, let's say, new and want to pursue a career in healthcare, can we talk about, as an employer, where would you suggest they start? Where do you begin if you are interested? And this is something that it's a question I get a lot as an immigrant also, that, when I'm in immigrant communities, meeting leadership, I often get asked, how do I start? Where do I begin? I'm interested in healthcare sector. So I'm curious if either from an employer perspective first, maybe, and then for those who have already been successful, if you have any thoughts to that.
This is, excuse me, this is Chad from Winona Health. Where to start, coming from the hospitality HR world before I became into the healthcare, a lot of those skills from the hospitality do transfer over into the healthcare. So when we've had people come in, we've really talked to them like these, you're just taking care of people, you're taking care of patients and all that. So we've had some success with that. I challenged our managers and directors to be a little bit more flexible with the people and their schedules. And that seemed to have really helped us out as well, with the childcare that's going on, and they needed to stay home. And so we've talked about that, and that, again, it's not just the clinical side of it. We also have, the patient access reps, the culinary side and all that. So we've really focused on that. And, it's not for everybody. The first year I was here, I was like, what am I doing? I'm going back to hospitality. But then it just kind of seemed to get a little bit better, and every day gets a little bit better. And this, dare I say, the pandemic it's been good for us to say, hey, we need to change the way we think as an employer on how we're going to keep our employees happy. And so I don't want to say it's been fun, because it hasn't, but it's been a learning experience for all of us. And so we've really taken a look at how we can do things differently as well.
Thanks, Chad, for sharing that. Thank you. I'm curious if others have any response to that or comment.
So I'm Nadine Holthouse with the Adult Basic Education Program in Rochester, and many of the adult basic education programs throughout Minnesota are doing CNA or CNA prep work in their community. So that's really a good place for immigrants and refugees to connect with, to kind of get it started, that process started.
Wonderful. Thank you.
I also wanted to highlight Health Force's website, Caring Careers Start Here, which was actually kind of revamped during the pandemic to also act as maybe a landing page for potential hires. But that's a good healthcare career explorer website. And I know we had some kind of high-level discussions at one point about adding some more content to Coursera for healthcare careers. I think that could be another opportunity and connection point for people to know about all the many offerings. Yes, there's a lot of clinical careers, but there's an entire lattice within all the healthcare settings.
Excellent.
This is Nadine from Assumption Home in Cold Spring. And a few years ago, I was part of a program that was started, actually it was started in Iowa, and I was part of a program. It was the 7th program launched in Minnesota. And this might be something that Deed can check into for us in the healthcare professional. I came from banking and finance HR world. And it's called Creating Entrepreneurial Opportunities. And it not only applies to healthcare, but every field. And it's introducing students at the high school level. It's a different way of learning. So if you look on Facebook or Google Western Stern CEO program, I was part of starting that one, and it actually started in Candy, Ojai County with Wilmer, and it was a banker from Iowa that started it. The challenge for a lot of smaller businesses is the cost, because it's like $1,000 a year to be part of the program. And what you sign up for is you sign up that you would have people available in your field to mentor students, not only in that field, but just in general of learning the jobs in a business, how to run a business, and they learn soft skills. They never go to class in school. It's like a 0 hour, but class is held at the business itself. So they rotate where they meet. They tour every single business that's a part of it, so you can share what's there. And it's a whole year-long program. The businesses wins because you introduce students to all the fields in your thing. You can assign mentors for the students from your business. Plus, you do get advertising out of it. You're on their website, you're on different things. And again, there's only 7 programs in Minnesota out like this, but that would be a cool thing if Deed could say, okay, businesses, here's and I know the gentleman, which I can give to you if you're needed, that started the program that I was with. And here's a program, it's $1,000, short grant process. Let's get involved and give an opportunity to get those programs going in communities where they're not, in communities where they are. Go ahead, here's money, be part of it. Really cool solution, very nice thing. Another thing is with your high schools, and this is a state thing, it's called World's Best Workforce, and maybe who's on from Rochester School knows about the criteria that's around the world's best workforce. That's another bridge that's connecting the schools and the workforce. So that's another board that I'm on. So I have that connection into the local high schools. Sorry, I've done a lot with
thank you. Well, thank you so much.
So those are tools that are already out there.
Excellent. Yeah, I remember I was I went to Atlanta last year with commissioners of MDE and higher ed. And the topic was, 9 states came together to discuss how can we align K-12 higher ed and workforce, so that we're building the pipeline for the long haul, for our state. And so this, some of these ideas I think are excellent and critically needed. Yeah.
This is
Sure.
Marcia Danielson. I'm with South Central College. Thanks for this opportunity today. I just want to share an idea of exactly what you just talked about, a partnership. We have a partnership with the Faribault Public Schools, Alina and Mayo Systems, and the Faribault Chamber of Commerce, and it is for health sciences, where students in 10th through 12th grade can be dually enrolled in high school and South Central College. And along the way, we've built in a lot of these certificates that you're talking about. We have trained medication aid, we have CNA, HHA, LPN, medical assistant, phlebotomy, and health unit coordinator. So they can, they can graduate a year earlier from college with an LPN, but they can earn these other certificates along the way in order to be able to help support their family. Because one of the things we found in Rice County is that students are dropping out because they need to help support their family. So we're putting this program together. This fall will be the second year of the program.
Excellent. Thank you for sharing that. Yeah, I mean, it's absolutely states who are, coming up with some of these type of programs are finding, themselves, for the long haul. Thanks.
Deputy Commissioner Wolf,
Yep.
This is
Go ahead.
Tammy.
All right, I was just gonna call you. Go ahead. All right.
This is Tammy Beery from Career Solutions. We have partnered with CentraCare in 2015 with our Career One. It's our summer youth employment camp, where we take for 5 weeks and teach them the soft skills that they need to get jobs. But in 2015, we started to embed more healthcare components. How can we get them more into the career pipeline for healthcare? And we started in 2015 with 60 students, and here we are. Pre-COVID, we had 150 between St. Cloud, Paynesville, and Sauk Center in the Career One camp. We have also added tracks specific to healthcare. So students, if they go into the healthcare track in Career One, they will leave with 3 credits. One is first aid CPR, college credits, and 2 in the healthcare core curriculum. So this starts to tie them back to the colleges. They've already got that advanced learning, and then they can come back the next year as a mentor. And after they complete their mentorship in Career One, helping lead the groups, then they can also do a work experience within CentraCare or other healthcare industries areas in St. Cloud. One example of this is one of our students that went through Career One, came back the next year as a mentor, then enrolled in our Youth at Work program, where she did a work experience at Vital Life, which is an EAP provider in the St. Cloud area as well as throughout the state. We worked with her through the WIOA in-school youth program. Then she transitioned into WIOA out-of-school youth, where we assisted in helping her complete her program for nursing. And she is now to the point where she's at the end of that, waiting to take her exam to become an RN. So that just shows how we put someone in that pipeline and we helped support and guide them through it.
Thank you, Tammy. Thank you so much. Let's see. I want to make sure I'm getting. So Connie.
Yeah, it looks like Connie raised her hand.
Yeah.
Hi. Yes. Thank you so much. We have many programs that can pay tuition for people going into healthcare, and we job consult people to do that routinely. But I want to recognize the importance of the employer relationships. I work in the area that Deb Barnes is in. And, that relationship with the employer is so important, and that buy-in from the employer and listening to what the employer needs. So, I applaud all the employers here today. You are the interested ones that are willing to work with us. I worked through the recession, and we didn't always get that buy-in from the employers because they had a lot of people to hire from. And the one good thing that the labor shortage brought about is it brought more employers to the table. So I just wanted to mention the partnership with the employer, with our workforce council in South Central, with MVAC, our partners, and the colleges, South Central, how important that is. And we do have funds, and what we're running into in the career force centers, we can't get the job seekers in our grasp. We have money, we have programs, we have the employer, but they're just kind of, some of the job seekers out there are content right now, it feels like. They're afraid maybe. So we're going through some of what employers are, is we're ready, we want them, but we're not getting the response. We've advertised in newspapers. We just printed 1,000 flyers to put in a drive-through job bank or a food bank event in Mankato. So I think all of us here are ready, and we just need those bodies. So
yeah,
thank
you, Connie. Before I turn over to Chess, take Chess's question, we have few job seekers on the line. So Matthew and Sam, I'm wondering if you can share a little bit about your personal experience as a job seeker. I think that can help inform, some of our employers on the line. So maybe Matthew. Might be on mute.
There you go.
All right, thank you. Can you hear me?
Yes, yes.
Okay, so me as being a recent graduate, I'm really excited to hear about the conversation that there is a ready job market for healthcare, and that's a very good feeling, because now that I know once I'm done, once I get certified, I should not be struggling looking for a job, and I know that my career is secured and my family will be taken care of, and that will also allow me to recommend other people that, hey, if you join you will never go wrong if you join a career in healthcare, because there's a job, you are guaranteed to get a job, and you can progress career-wise, and you can work in any field. You can work in a hospital, clinics, schools, anywhere, because they need nurses in very many areas.
Thank you, Matthew. Thanks for sharing that, and congrats for being almost done with your certification, and excited that you have a number of employers who are hearing this now. So I think watch out for emails. Folks will be coming to you.
Sure, I'll be waiting for those emails.
Yeah, I want to put a plug here. Yeah, I want to put a plug here for CareerForce, and I'm sure, Matthew, I'm curious, have you used CareerForce MN yet for your job search? Or
yes,
yeah,
yes, I have used CareerForce, and I found it very helpful because they have a lot of job opportunities there. So that would be my place to go looking for a job.
Excellent, excellent. Thank you.
Thank you.
Sam.
Thank you.
Hi, I'm a CNA at Lakeview in long-term care, and the biggest selling point for me coming into this field was the scholarship program they offer here. You work a year, and then they help you move on to your LPN, RN, and I've even seen BSNs. So that was the biggest selling point for me here, and I look forward to moving forward.
Excellent. Thank you. Thank you for sharing that. I know we have about 15 minutes, but I want to give, I know Chess had his hand raised, so I want to make sure I get to as many people as we can before we conclude. So Chess?
Yeah, Deputy Commissioner, thank you. And thanks, Sam and Matthew, for sharing your insights as well. And yes, we definitely would welcome Matthew as he continues to pursue. And Sam, I'm glad you found a spot in healthcare and are successfully liking that as well. I just wanted to touch on, you talked about different solutions, and also where can people go and where could they find opportunities. I think, and we've we've also addressed what some of those barriers are, maybe the fear or maybe lack of resources in order to kind of get into that career pathway, whether it be childcare issues or needing a current, job, in order to get the additional schooling, those types of things. I did want to I think the way you can also help is not only continue to invest in solutions that work in our regional areas that a lot of people have highlighted, but also highlighting those avenues to get in there. You asked where to go. I know some of my team members from our Bridges to Healthcare program, we've had that around for the last 7 years, but it's really a partnership with our local Workforce Development Center, Nadine from our Hawthorne Adult Basic Education Center, our Rochester Community and Technical College partners. But the awesome thing about, and Mayo as well, Mayo Clinic, which I'm a part of, but the great thing about this pipeline program, it not only provides these job seekers with the education and training, but also the resources, those wraparound resources, transportation, all those different things that are typically barriers to entering the workforce. This program is already baked in. Since we've been able to have it for quite some time, we've been able to open up job seekers of all ages, into various healthcare pathways, whether it be our PCA positions or phlebotomy or, a nursing assistant or technician positions. And now that we've actually had it and it's been sustainable, we're seeing, growth into our RN and our PN positions. So, those things that sometimes when we're not continued to have that investment there, we're out there trying to seek and find what grant to apply for and what dollars in these programs that do work to seem to kind of just not be sustainable. But for us, it's been a huge way for us to reach maybe a different population that needs additional resources outside of our traditional youth that are coming up through the school system.
Thank you so much. That's a helpful context and kind of that holistic approach, to issues of workforce is critical. And I'm sure I've, connected with a number of you in the past, about the need to look at, the workforce development fund and ways that we can strengthen our infrastructure, to meet, the needs of 21st century, whether it's removing barriers, such as, or what we call workforce adjacent issues of, transportation, childcare. I mean, digital divide is going to be a big one, especially this coming, not this coming year. We're already in 2021 on, issues of, people who don't have access to the internet or don't have a laptop or computer. Those are issues that, we collectively need to address to make sure that, job seekers can, it's a barrier that we can remove for job seekers connected to employers. I'm curious if we can maybe, I'm wondering if I can carve out a few minutes about ways we can work together, especially under career force. How can we work together more and what areas that you think, but before I do that, I see Deb raising her hand. So Deb?
I was just going to add one kind of minute issue before we go on that. But it seems, we've talked a lot about we do need certified nursing assistants and LPNs, but we all still do need very skilled RNs to provide the nursing leadership. And it seems, I hope DEED has some kind of relationship with the colleges or develop some kind of relationship with the colleges. It seems that in college coursework, long-term care is kind of at the bottom of the barrel. And I think someone else mentioned that too. And even, even placement, the placement people from colleges will say to students, oh, you don't want to start at long-term care, that you want to start in the hospital. And that may be true for some people if their skills are in that area or more in that area. But long-term care registered nursing is a very rewarding experience. And these nurses need to be globally focused. There's no physician in the building. They're going to have a staff of CNAs to lead. It's a different type of leadership. It's a different type of nursing, but it certainly is equal to other nursing positions. And we feel sometimes that the colleges downplay that, make it sound like it's a walk in the park. And actually, these people have more demands on their decision making than anyone in the hospital. So if there's any type of relationship building that can happen with the schools of nursing, it would certainly be a benefit to long-term care providers.
Hey, Hamza, you're on mute.
Oh, thank you. Thanks very much. Yeah, I see a few more hands, so I'll maybe hold off the conversation about partnerships more. Marsha, I see you raise your hand, and I believe Kristen, if you can give more about how we, the holistic people with the greatest needs and how we can remove more barriers. But I'll move first to Marsha.
Thank you, Deputy Commissioner. Marcia Danielson, South Central College in Mankato and Faribault. As far as a partnership is concerned, we have just been approached by Mayo Clinic about the need for more surgical technologists and the fact that they're retiring out faster than they're being replaced. And so they came to us and said, any chance you'd be willing to start a program? So we went out to other healthcare providers in Alina, Newell Medical Center, the Mankato Surgery Center, Rivers Edge Hospital in St. Peter. They've all come to the table, and we now are putting together a program that has other certificates, again, built in as a pathway. We'll start, we've actually hired the director already now, and we'll start registering next fall. So that's a kind of a partnership that, if there are occupations out there that colleges are not churning out enough people for, don't feel like you can't approach the college and say, would you consider putting this program together? We wrote a grant and we were able to hire a part-time director to get things going. So just an example.
Wonderful. I am mindful of time and I see a lot of hands. And so what I'm gonna do is maybe first call Janine Mason.
Good afternoon. Thank you very much for just hosting this conversation today and bring us all to the table. I think this has really been great. I just wanted to introduce myself. I'm the Associate Dean of Nursing at Minnesota State College Southeast. We have campuses in Red Wing and Winona. And I'll put a vouch out for Matthew, anyone that wants to send him an email. He's a recent graduate of ours and did a great job. So congrats to Matthew and the other graduates and future employees, I should say. And also just to mirror what Marcia said, I think the colleges are very committed. We are committed as well. If there's a need out there or a certain program, job specific that is needed, I know I can speak for our college that we are committed to making that happen. So I think, like when Connie mentioned there's dollars available, sometimes I just think maybe all of us don't know where to find that or what the resources are. And I know this is a huge project, but it would be nice to know, to somehow bring that all together and know what those opportunities are for students or for future employees. But we too tried to kind of fast track things. We're probably a little behind Marcia at South Central, but we're reaching out to our local high schools as well and developing some LPN in the high school programs just to keep that college debt down for students for one, but then also get them out into the workforce sooner. So also agree, I know we're getting short on time, also agree on some of the barriers, childcare, poverty, food support, food insecurity were things we encountered during COVID. And so I think the colleges are doing a nice job of trying to break down some of those barriers as well. So
yeah, thank you, Janine. And I know
today.
Yeah. So yeah, thank you. And I know also issue of mental health is especially with COVID. Kristen Saylor, I'm wondering if you have any quick comments about just the needs of folks with the greatest needs. Kristen.
Yes, thank you, Commissioner. I I had have been following the discussion, and you guys have all hit on the things that we've been hearing in the Southeast region from our long-term care people in our coalition. There is some of the comments I'd like to reiterate that were said about funding sources and getting that information to the facilities of long-term care agencies, and just really making that connection with the workforce strategy consultants through Career Force has been a very outstanding thing for our region to highlight that have been occurring in the last several months.
Yeah. Thank you, Kristen, and very grateful to the incredible work of our workforce strategists, consultants rather, and our overall staff at Career Force. The team has really pivoted in the midst of once in a century like crisis, just immediately. Not without challenge, obviously, but just shifting towards more virtual and continuing to provide services. Obviously, we want to open up Career Force locations as soon as we can safely do so. Some are, operating at a limited capacity, but our goal is, with the vaccines, just really as soon as we can to open Career Force locations. I want to leave a few minutes for press, but Nicole, do you want to maybe you have last word here before I turn over to Jan, and in case there's any press.
Thank you, Deputy Commissioner. Sure, I just wanted to highlight the fact that I appreciate all of these disparate interventions that we're doing to try to grow our workforce and be creative and be, customized to the setting. But I really do think that it's a very large issue that calls upon us from a public health perspective to kind of harness collective will so that we can grow a workforce. I mean, we're waiting. We're waiting for enough people, enough bodies to take up these positions. And I do think that it calls for something bold and something big to ensure that we have enough people to support the healthcare workforce in the coming years and to take care of all of the aging people. So just had to put that out there.
All right, thank you. That's a good way to conclude our comments and conversation for this morning. I assure you this will not be the last conversation. I look forward to continuing our conversation in ways that we can collectively advance our state's economy and meet the needs of our employers and provide opportunities for our job seekers. And so thank you to all. Jen, are there any questions from media? I want to just over to you.
Yeah, let me just ask if there's anyone with the media on the line who has a question, if you can raise your hand. Just have a minute or so left. I want to make sure we get any of your questions answered if you have them.
Looks like we have answered all the media questions through the conversation.
That's right.
Yeah, so I guess we'll conclude, and again, really extremely grateful for your generosity of time and really making yourself available for this conversation. If there are other ideas for our agency or for the state, if there are ways that we can, any feedback that what you want to share with us, we would really appreciate, and I look forward to reconnecting soon. Thank you.
Thank you.
Thank you all for joining. Thank you so much.